Hey everyone, I'm your host Adrian. We do content like this weekly, so hit the subscribe button and ring the bell to get notified. If you want more content like this, click the like button and please leave a comment. Thanks again for watching. Hello everyone, welcome to today's Rupa Live class presented by Rupa University, the best way to learn about specialty lab work from industry experts. My name is Adrian Martinez and I will be your host for this afternoon session. Today we have a very special session with two guests in Dr. Andrew Wong and Araceli Benavides here to discuss integrating CDI's breath testing program into your functional GI diagnostic strategy. Before jumping in, a couple of quick housekeeping items to go over. Everyone joining will be muted by default, but don't fret. If you do have any questions, please use that Q&A button down on the bottom, and yours truly will go ahead and answer those questions along with the presenters today at the end of the session. Be sure to hop in there and ask those questions. We've actually planned for a longer Q&A session today and a bit of a shorter presentation. That way we can make sure we get to everyone's questions throughout the presentation. Immediately following the Q&A, I'll show you exactly how to order the CDI test directly from Rupa Health. And if you have to jump early, no worries at all. We are recording this session as we always do, and we'll go ahead and send that out to you once we've had the opportunity to do a couple edits to it, and it will always be posted on rupauniversity.com. Following that, you can find access to all of the previous content that we have done on rupauniversity.com. So be sure to check that out to get access to all of those previous videos. So with that, let's go ahead and jump in. I'd like to introduce Dr. Wong and Araceli Benavides. Dr. Andrew Wong is founding member of Capital Integrative Health based in Bethesda, Maryland. He received extensive advanced training and certifications in holistic, integrative, and functional medicine, acupuncture, and meditation. Dr. Wong received his MD from Tufts University School of Medicine and completed his internship and residency in internal medicine at Georgetown University Hospital. Araceli Benavides has used her personal health journey as motivation for entering the field of nutrition and integrative medicine and is now an integrative nutritionist at Capital Integrative Health, along with Dr. Wong. She is a board-certified nutritionist specialist, licensed dietitian, and completed the Institute of Functional Medicine certification program. That's IFM for those tracking at home. She has also received a Master's of Science in Human Physiology and Integrative Medicine from Georgetown University. Thank you both so much for joining us today. I'll go ahead and let you take it from here.
All right. Thank you so much, Adrian. And Araceli and I are very honored to be here to present on behalf of Rupa. And we're excited for this opportunity to discuss this SIBO test that we've really been using for the past 8 years since we opened our clinic in 2015, which is Commonwealth Diagnostics International breath tests. So we're talking today about integrating this breath test. If you're which I think everyone probably is, a clinician here, how do we integrate breath testing into your functional GI diagnostic strategy using breath testing as the new gold standard? So we can advance the slides, I think. Okay, so let's talk about the issue. We know that in integrative functional medicine, which we're all clinicians that are really dealing with issues of gut health. Over 100 million people in the US alone suffer from GI symptom or disease. And we know that, from our patient population, we have a pretty general clinic in terms of we see people with a lot of chronic health issues, but we know that one of the root, common denominators is actually really GI disorders, especially irritable bowel syndrome, or that's what we kind of conventionally label as, right? So we can, have people with abdominal pain or cramping, bloating, diarrhea, or constipation are mixed, but this is expected to affect about 15 to 20% of the global population. But we all know that IBS is really a label for underlying root causes, right, in functional medicine, and that up to 84% of IBS patients actually suffer from SIBO, and of those, 75% are not diagnosed with SIBO. So a lot of times what we're saying, we find in our clinic that, lots of people, up to 84% of people actually have SIBO when they're labeled as IBS. So this is definitely one of the things that as clinicians, we're going to want to look at, does someone have SIBO or not? And then we're going to get into the root causes of SIBO in this presentation as well. So here's the reported SIBO prevalence in relation to other conditions. So these conditions are associated with SIBO. So if you just take a healthy control population, the reported SIBO prevalence is between 0 to 20%. It is higher in different gut syndromes such as celiac disease, IBD, including Crohn's, chronic pancreatitis, irritable bowel syndrome. We usually kind of use that as there's different studies, as you see here, that percentage from 4 to 78%, a very wide range. We see in the literature typically that it's about 60 to, at least 60%, 60 to 80% of IBS is SIBO as one of the root causes, at least, of that. And then there's other conditions like immunodeficiency syndromes, rosacea, Parkinson's, and low thyroid as well. So here's a bit of a pathophys kind of walkthrough here in terms of how SIBO develops. What are some of the reasons why SIBO might develop? So if you look at those pie charts on the left-hand column, those are irritable bowel syndrome patients. And this is a study published in 2017. And then on the right, you have healthy subjects that do not have symptoms of irritable bowel syndrome. So you see on the left side that on a upper gut aspirate culture, typically in the duodenum, I believe, that 67% of patients do not have SIBO, but 23% of people do. However, if you kind of go down that list, you can see how on a glucose hydrogen breath test, 26% of people have SIBO, that have IBS symptoms, and then it jumps to 45% with people that have a lactulose breath test. So you can kind of see that, and this is testing for hydrogen or H2, as you see there. On the other side, on the healthy subject side, you see that not as many people do have SIBO, but you can also see that the breath test is actually a bit more detecting when they have IBS. So 45% versus 21% there for the lactulose H2 breath test. Now, SIBO will actually be caused, or at least the groundwork is laid for SIBO with different physiologic conditions that are on the upper left-hand side of this slide. So we see that there's a pathogenesis of SIBO abnormalities in the following settings. One is if someone has an immunodeficiency. That could be a low salivary IgA. That could be a low secretory IgA. And, we often can check, for instance, people with a serum IgA level that might be low. And we know that the IgA is the immunoglobulin that's in the mucous membranes, including the gut, as having a mucous membrane. So if someone has low IgA, then they are more likely to have bacterial overgrowth, including SIBO. Number two is enzyme deficiencies. So we think about these things like gastric acid or stomach acid. We think about duodenal bile. And if either of those are low, that would also be an association with SIBO. So we know that both stomach acid and bile acid are powerful antimicrobials. And in fact, we would argue here that they are more powerful than any supplement that we could give the patient. So often we also look at in our clinic, actually, how their stomach acid is doing. I don't think we have a specific test for bile unless we use potentially other tests too, like stool tests, but we're going to look at stomach acid and bile acid. And if those are low, that's going to be a loss of that antimicrobial effect. Then people will get SIBO from that. We also see that people have abnormal GI motility. So if the gut's not moving, then that's going to mean that migrating motor complex in the intestine's not moving, and that bacteria can get either translocate up from the large intestine to the small intestine, or just not clear out of the small intestine and start overgrowing there and causing SIBO. So motility is another big factor, which is why hypothyroidism is actually one of the most commonly associated conditions with SIBO. In addition to that, there's the Paneth cells, which are found in the small intestine, the duodenum, and they secrete alpha-defensin, which is another natural antimicrobial. And so people that have problems with the Paneth cells and have a low amount of alpha-defensin would also have an increased risk of SIBO. And then finally, structurally, there are some other conditions that like ileocecal valve dysfunction. So the ileocecal valve is between the cecum and the ileum, right? So if there's a leaky valve for whatever reason, whether it's a surgical aspect or trauma or some other cause of ileocecal valve dysfunction, potentially also people with connective tissue disorders like Ehlers-Danlos syndrome could have an ileocecal valve dysfunction. This would also increase the likelihood of translocation of bacteria from the large intestine retrogradely to the small intestine, to the ileum. And then there's other factors that are associated with SIBO, which are listed here, like female gender, increasing age, irritable bowel syndrome, diarrhea subtype, marked bloating and flatulence, and then certainly PPI and narcotic intake. PPI is because they decrease the risk, they decrease stomach acid levels, and narcotics, of course, would decrease the gut motility, and then low hemoglobin as well. And then you can also see that SIBO on the bottom part of the slide is also associated and results in different, systemic conditions like GI dysmotility, visceral hypersensitivity, immune activation, meaning probably overactivation, as well as an increase in zonulin and increase in gut permeability, as well as a a decrease in absorption of different nutrients, including carbohydrates, including fats. Bacteria will also actively deconjugate bile acid, which leads to a bile acid deficiency, which then goes in that vicious cycle of not having that antimicrobial bile acid to reduce the bacterial load, which then perpetuates the SIBO. So I wanted to spend a lot of time on that slide just to kind of go through some of those pathophys there. Go on. So one solution is really to look at, if your patient walks into your clinic with irritable bowel syndrome symptoms, and you're wondering about, SIBO, do they have small intestinal bacterial overgrowth? Are we going to send them to a GI doctor to do a duodenal aspirate? Probably not, because it's invasive. It's something that the patient probably doesn't want to be sedated for that. It's expensive. We're going to use something that actually is more sensitive, which is a breath test. And in fact, there have been a lot of times where people can go to a doctor and get breath tests in the office, but they'll have to sit in the office for 3 hours and kind of get monitored a bit and things like that. So we're going to talk in another slide here about how we have a more convenient way to do breath testing at home. But breath tests are sophisticated, they're scientifically validated, and they're really tools that are going to evaluate functional bloating, diarrhea, constipation, and suspected malabsorption. So whether that's small intestinal bacterial overgrowth or other malabsorption of different sugars, it is thought that based on the research, that a combined hydrogen and methane breath test has been shown to be superior for the diagnosis of both carbohydrate malabsorption syndromes and SIBO. So what that kind of means is that a lot of times in the traditional realm, there was kind of this idea that we can just send someone to an office and they get breath testing. But what we usually see clinically is when we look at those tests, a lot of times they're not testing both hydrogen and methane. They're just testing hydrogen gas, which we know that that's missing a lot of SIBO, because a lot of SIBO is actually intestinal methanogen overgrowth, which Araceli will talk about later. So these tests, as I said before, are simple. They're safe alternative compared to these more invasive procedures such as biopsies and or aspirates. So the North American Consensus on Breath Testing, which is a pretty recent statement over the last few years, really stated that breath testing represents an important, simple, and safe test to diagnose carbohydrate maldigestion syndromes and SIBO. So, if people are wondering, where's the evidence, where's the guidelines, there is a consensus on this now, which is nice for us practicing in integrative medicine. And let's talk about indications for breath testing. So we know that SIBO can be an underlying condition for IBS. In fact, 60 to 80% of IBS is really SIBO. We also know that SIBO could be a cause itself of other carbohydrate malabsorption disorders. So general breath testing recommendations that are based on clinical research is that if a patient presents with IBS symptoms, which are listed here, it is reasonable to use a SIBO breath test as a starting point in your diagnostic plan. Certainly, we would say people with upper symptoms like this, right? So if someone's having lower symptoms, you might be looking at things like functional stool testing or GI referral colonoscopy. If a person presents with symptoms that are triggered by specific foods, such as milk product, this might be something where you use another type of malabsorption breath test as a starting point in your diagnostic plan. And if there is on the other hand, if there's a positive malabsorption test, then you may want to also check for SIBO as well. So we're talking today both about SIBO testing, but also about carbohydrate malabsorption testing as well, because you can see that they're interlinked here. So these are the tests that Commonwealth Diagnostic International offers as non-invasive at-home breath tests. So we start with the SIBO test, which looks for both bacterial overgrowth and methanogen overgrowth. So it's going to test for both hydrogen and methane. And it's very much so a common cause of bloating, diarrhea, constipation, functional GI disorders, but also suspected carbohydrate malabsorption. And then the carbohydrate testing is going to be fructose, lactose, and sucrose malabsorption. And you can kind of see some of the symptoms there that may be associated with those conditions as well. So the benefits of the breath testing program, Commonwealth's program, is that it does offer this point of care testing that the patient can do in the comfort of their own home. It does reduce certainly PPE costs, COVID risk, especially in the era of COVID now. It's much more convenient. We can just have these kits shipped out to the patient's home address or wherever they are. Sometimes they're actually traveling and they're somewhere else, but they're going to be there for, telework for 3 months. Then we can just kind of send it to wherever they are. We also know that this is a validated test. This is based on these North American guidelines. This is something that has been researched, and there's actually a lot of consensus around the clinical data that's necessary to guide patient diagnostics and treatment in a systematic way. We also know that you can repeat the breath test like you see here. If someone has an in-office visit or telehealth visit, you can order that breath test. You can do a follow-up telehealth visit with them. You can then discuss a treatment plan, follow up with a clinical kind of follow-up on the treatment plan. And then at the end of the day, at some point, whether it's 3 months, 6 months, or longer, you can check another breath test to kind of see where you are. Araceli will talk more about the details about that. I think in terms of with Rupa Health, you can, and maybe Araceli or maybe Adrian, you want to talk a little bit about that towards the end here, but there are different ways to, depending on what you want to do for your clinic, either offer the test at cost to the patient or upcharge for the patient, et cetera. So that's where that kind of comes in. Thanks, Adrian. So I'm going to hand it off to our amazing functional nutritionist, Araceli, to go into the details of the SIBO breath testing and treatment.
Thank you, Dr. Wang. So yes, this test can be very helpful for our patients. So once we order the test for the patients and they complete this test at home, they send it back to the lab. And these are examples of the type of results that we can find. So on the top part, we see positive, an example of a positive test. So on the graphs, you're going to see that 1 through 7 represents the small intestine, and then around 7, it represents where the ileocecal valve would be, and 7 through 10 is the large intestine. So we see that there's different thresholds for hydrogen and methane. For hydrogen on the small intestine, we would like it to see below 20 parts per million of gas, and for methane, below 10 parts per million of gas. So the results could be either showing high hydrogen and no methane, and typically for these patients, we see that they experience looser bowel movements or diarrhea. Or on the other hand, we could see high methane and no hydrogen, and these patients tend to experience more constipation. And they've now changed the guidelines to call, instead of methane SIBO, it's called intestinal methanobacter overgrowth, because it could cause the symptoms even if when it's present in the small intestine, but also when it's present on the large intestine. And right now we'll talk about what the testing shows, but we're also going to talk about how to address it. So if we find hydrogen compared to methane, we treat it in a different way. Although symptoms can sometimes be very similar on the side of abdominal pain, gas, bloating, and some other symptoms related to SIBO. And we could also find both high hydrogen and high methane on the test. And we would have to treat both gases. A lot of the times when we treat methane, we see hydrogen come up because we need 4 hydrogen molecules to convert to methane. And that's totally normal. That can happen when treating methane. And then after that, we would treat hydrogen. And the other type of result, besides a negative test, of course, would be a flat line, that it would technically be not supported. But when we see a flat line and we just see 0 for methane and 0 for hydrogen, and we know the patient has collected the sample correctly because we see that the CO2 levels on the test, which is not shown on this slide, but when you receive a test, it'll say if this amount of CO2 on the test tubes was accurate. If the test was collected accurate, but we have a flat line, we suspect hydrogen sulfide SIBO. And we probably would correlate this with symptoms, and we might also treat it. So all of those are options for positive tests or supported test results. And on the bottom, we see a common not supported test result where we just see low levels of hydrogen and methane below the threshold, or just like higher hydrogen baseline, but the amount of gas doesn't peak. So those are the different types of results that we can find. On the side of the treatment, we always want to try to address the underlying root causes, like what Dr. Wong was mentioning before. If there's impaired motility or if there's not enough stomach acid or any medications. So when possible, we always want to treat the underlying cause. And we use herbals, nutrition, or pharmaceuticals to treat and kill off bacteria that can be producing these gases on the small intestine. So first, we're going to start by talking about some herbs that we use and certain nutrition plants that we can use along to help with the treatment. And then we'll talk about some pharmaceuticals or antibiotics that we can also use. So for hydrogen SIBO, we use berberine, oregano, or neem, and you typically want to combine 2 of these to make it more effective. And there's some combination products like the ones with candibactin BR and AR that have other aromatic oils that can still be helpful. But like, for example, candibactin BR has mostly oregano and berberine, and Candibactin AR has mostly oregano. So combining those of two types of herbs can be very beneficial for hydrogen SIBO, and there's some studies done with those products as well. And then when we have intestinal methanobacter overgrowth, or when we have a combination of hydrogen and methane, or patients are experiencing constipation, we want to address it a little differently when we're doing herbals. And we want to try to use, if possible, if patients are not allergic and they can tolerate it, allicin, which is a garlic extract, the part of the antimicrobial part of garlic. And we want to combine this with either berberine, oregano, neem, or a trantal, which is one of those, and we combine it with allicin. The timeline of the treatment depends on how much gas the test shows. Typically, every 4 weeks of herbs tend to lower about 30 parts per million, but we always personalize these to the patients, and we might add a biofilm breaker to make it more effective. So yeah, we definitely make these very personalized to what we find on the tests. But for sure, once after we do an antimicrobial therapy or an antibiotics, we always want to make sure we use prokinetics for at least 3 to 6 months after the treatment to support motility. And this also helps to prevent recurrence of SIBO. And this could be if we're using more supplements instead of prescription medications. We can use high dose ginger, Model Pro, that has the high dose ginger, but also has 5-HTP and artichoke extract, so components that would still help with the contraction and activate the migratory motor complex, and other products like Iberogast or SIBO MMC, which they're similar, the way that they act, or Motility Pro. And besides the prokinetics, we would also, depending on the case of patients, we would recommend doing a low FODMAP diet combined with a specialized carbohydrate diet. In these cases, we try to use these diets while they're using herbals as treatment, and not so much when they're using antibiotics. And also if these type of nutrition plans are helping their symptoms, because we know a lot of healthy foods, like a lot of vegetables or cruciferous vegetables, can be high in FODMAPs. So if it's not really helping them, we sort of personalize their food plan to what it works better for the patient. And in some cases, we also use the elemental diet, and it's 2 weeks of the elemental formula to help basically it's starving off the bacteria to treat the SIBO. So that's all the options for the more natural route. And then we'll talk as well about some pharmaceuticals that we can use. So for only hydrogen SIBO, we can use rifaximin, or the brand name is Xifaxan, which is FDA approved for IBS-D, or traveler's diarrhea, and hepatic encephalopathy. And we are sharing here some dosages that we use. And along with this, we also use partially hydrolyzed guar gum to increase the effectiveness, to sort of get the bacteria out, and then use rifaximin to kill off those bacteria in the small intestine. And we're going to see in the next slide some research behind that as well. And when we have intestinal methanobacter overgrowth or mixed type of SIBO, or patients with constipation, we do need to combine rifaximin with either neomycin or metronidazole to make the antibiotic therapy effective. I do want to mention that we use the antibiotics for, typically, if we use antibiotics, we use it for 2 weeks, and then we might combine it. So we might use antibiotics and then herbs, or vice versa. So we don't necessarily use just one or the other. But we do find it helpful sometimes to combine. And we also have prokinetics that can be pharmaceuticals. We can use low-dose erythromycin, that although erythromycin is an antibiotic, when it's low dose, it can have a prokinetic effect. Or we can use low-dose naltrexone or prucalopride as well. So different options for the prokinetics that we would use after therapy. And this is a systematic review and a meta-analysis, which basically shows, so rifaximin is the most studied antibiotic. And the good thing about rifaximin, it is not systemically absorbed, so it doesn't have the common side effects of regular antibiotics. And it's very localized to the small intestine. And that's why it makes it so good for helping patients with SIBO. And it does have an overall breath test normalization rate of 49.5%. And this meta-analysis did show that the antibiotic regimen is more effective than placebo. And of course, the efficacy changes depending on the antibiotic regimen and the dose that it's used for patients. So definitely something helpful. And the other benefit of rifaximin is that it prevents antibiotic resistance, and that's why we use it in combination with neomycin and metronidazole to help. And this is a double-blind randomized control trial used in patients with IBS-C and with methane detected on the breath test. And they did show that when they combined the neomycin with rifaximin, it was more effective on improving their symptoms, mainly when for the constipation, the bloating, and the straining more than the abdominal pain, but it was more effective in combination. And in clinical practice, we also use it with metronidazole. And along with the antimicrobial or antibiotic treatment, plus the prokinetics, we use other supportive treatments to try to get to the root cause. And we do also recommend for patients, if weight loss is not a concern or they're not underweight, we tend to recommend meal spacing to support the migratory motor complex. So we recommend that patients leave at least 3 hours in between meals. If they can do longer, that's better, and 12 hours overnight to activate the migratory motor complex. And if they've had any trauma to the abdominal area or they've had any surgeries on the abdominal area that could have caused any adhesions, we do recommend visceral manipulation, or if they have any ileocecal valve dysfunction, to help them with that. In addition, we also recommend doing some vagus nerve stimulation exercises that they can do at home, including gargling, deep breathing, alternated nostril breathing. They could do a minor gag reflex, many different things that they could do, including hypnotherapy for the vagus nerve. We always want to include these because the nervous system can play a big role in motility and just a big role in preventing recurrence, which I'll show case study as well as soon as we're done with this part. That also is a clear example of how important treating the vagus nerve is when it comes to treating SIBO. And then we don't want to forget, I know this is something very straightforward, but we tend to forget about chewing and mindful eating. The chewing and also like mindful eating would stimulate digestive output, including stomach acid and digestive enzymes. So just sort of paying attention and taking the time to eat and trying to be as relaxed as possible around food. We always recommend that to our patients. And if needed, depending on their situations and other tests that we do, like the functional test or the stomach acid test, we might give some stomach acid support and replenish digestive enzymes as needed as well. So here is a case study from a 46-year-old female patient, and she had a long history of digestive issues. And her presentation when I first saw her was that she would experience, especially when she was waking up, she would experience a lot of abdominal pain, racing heartbeat, bloating and gas. And then all of these symptoms will resolve after she would have a bowel movement. And throughout the day, she would experience nausea and she was tired, and in general, like gas and bloating throughout the day as well, and lose her stools. So she would feel an urgency and she would have lose her stools when she would go to the bathroom, and that was very uncomfortable for her and would cause a lot of anxiety. She had done previous SIBO testing and previous treatments with other practitioners, but she sort of had recurrent SIBO and it was very hard for her to get rid of it. So once she came to our practice, we tested her for SIBO, and this is what we saw on her test. She had a pretty high level of hydrogen, which correlated with her looser bowel movements. And she also had a history of a lot of anxiety. She was a very anxious patient. Because of the nausea, we decided to rule out H. pylori as well with a functional stool test, and that was negative. And we ran some other blood work as well, which her CBC and CMP were within normal limits, but her thyroid hormones were a little suboptimal, which could be affecting her motility, gut motility. So we wanted to optimize that as well. And some lower than optimal, some suboptimal levels of zinc and vitamin D. So we also helped with the replenishing those nutrients, and we wanted to rule out candida to make sure that wasn't affecting as well with her symptoms. So as I mentioned, we replenished some of the nutrients because SIBO can also cause malabsorption of some nutrients. So we helped with some supplements at a time. We gave her some digestive enzymes and betaine HCl to support digestion. And we started again rifaximin with partially hydrolyzed guar gum for 2 weeks. And then we followed that with some herbal protocol. And then she had been doing a low FODMAP diet, but that was causing her to lose too much weight. And because she was already underweight, I recommended to slowly start to reintroduce some FODMAP foods that she she knew she could tolerate to prevent further weight loss. This patient was experiencing a little bit of improvement with the antibiotics and the antimicrobials, but what really, really helped her the most with feeling better was doing a hypnotherapy treatment for 6 weeks to help her rebalance the vagus nerve, and trying to help her with the anxiety with some herbs and some like breathing exercises. And once she got that under control and she was feeling better with the anxiety piece, we retested. She was very nervous to retest, so it took us 8 months to until she felt comfortable to retest. And her SIBO test, we can see there, it was totally normal, and it was like she was feeling much better. She was able to reintroduce the foods that she liked. She was eating without pain. She was having regular bowel movements, no racing heartbeats. She was just feeling good overall. And her hair, that she was experiencing hair loss as well, her hair was growing back. So a lot of different effects that treating SIBO and having this tool to test for SIBO and retest and just sort of follow up and make sure this has resolved and helped can be really, really beneficial for patients. So yes, this was the case study. And that was all for our presentation. So we definitely would love to open up for Q&A.
Amazing. Thank you both so much for that presentation. And Dr. Wong, I appreciate you being so active in the chat, answering those questions along the way. That's fantastic. We got actually some really good questions throughout the presentation. I'm going to repeat a few of them that came in through the chat in case people missed that. But also, if you do have any questions, be sure to use that Q&A button down in your menu bar, and we will go ahead and ask those as well throughout, of course, pending the timing that we have. So the first question we got was actually through the chat. Chris asked, how do you get low sec IgA?
So low sec IgA, secretory IgA, first of all, one thing that happens is in the bloodstream when the B cells produce these immunoglobulins, IgA, so it has to translocate over to the gut. And one of the vitamins that's needed for that is retinol, vitamin A. So definitely if we look at someone with a low serum level of an IgA, and then on their stool test, so sometimes we check a stool test, and that'll look at a low level of IgA there. That's going to be a situation where we're going to maybe check a vitamin A level on a blood test, like a retinol level. And then if that's low, then we can have them do things like eat organ meat or eat carotenoid vegetables and things like that. So, but from a perspective of, generally we know that low secretory IgA is really often a consequence of gut dysbiosis. So if someone has an imbalance in the gut bacteria, which you can see with SIBO or other conditions, that certainly would be a reason why they have low secretory IgA. There's also some genetic components as well, where, you would just see people that have low secretory IgA, low serum levels of IgA, which would affect even things like your celiac test validity. If you're checking someone with celiac and they have low IgA, you can't really use that tissue transcontaminase IgA level at face value because they already have a low secretory IgA. So I hope that answers that question. So we do like to treat the gut microbiome and kind of replenish the gut microbiome with different, prebiotic foods and probiotics. Maybe Araceli, you can get more into what we think there.
Yeah, totally. We definitely use vitamin A probiotics or vitamin A foods and mushrooms. Asian mushrooms can also help to stimulate the immune system. And we also use serum-derived immunoglobulins or colostrum if patients tolerate that, to try to stimulate more the secretory IgA. Any like chronic infections, chronic stress, chronic inflammation can also lower that secretory IgA.
Perfect. The next question is, when do you use PHGG?
What was the question again? Sorry.
The partially hydrolyzed guar gum. When do we use that?
Yeah.
Mm-hmm. Yeah, we use it along with rifaximin, so they can take it at any time of the day, but during the 2 weeks that they're taking the antibiotic, and we do one like scoop of the partially hydrolyzed guar gum a day.
And the reason is there's a study that showed that it increased the bioavailability of the rifaximin medication. So that's why we try to use that.
All right, folks, I just wrote this in the chat, but can you please use the Q&A button down instead of the chat function? It's a little bit easier for me to ask and track the questions through that instead of through the chat. Are you using spore-forming probiotics?
Mm-hmm. Yes, they're definitely what we would call more SIBO friendly, and patients with SIBO can tolerate spore-based probiotics better. There's different products that just have the spore-based probiotics, and that others that have it in combination with the serum-derived immunoglobulins, which can help as well the secretory IgA, since we were just talking about that. But yeah, we do use the spore-based probiotics.
Great. How do you address the vagal nerve, and have you addressed the vagal nerve?
So, I mean, we were, there's different functional training programs that we've done, but one of the ones we both done is the IFM course and Institute of Functional Medicine. And we talk about the 5R gut program, for healing there. And the 5th R is the rebalance, which is looking at the nervous system and the connection between the gut and the nervous system. So, we know from that training that actually, even though it's the 5th, it's not always the least. So it's like last but not least, because when we look at the rebalancing of the gut, we have to also rebalance the patient has to rebalance the brain and the autonomic nervous system. So the vagus nerve, as the main part of the parasympathetic part of the relaxation response part of the nervous system, is critical to upregulate that vagus nerve activity to really have a long-term lasting improvement in their gut health. So we really look at a lot of different modalities here. Like in our clinic, we certainly would do or think about things like breath work, especially exhaling longer than the inhale. That's going to increase your vagus nerve. So slow, deep breaths, exhale longer than the inhale. Dr. Andrew Weil, the integrative medicine pioneer, talks about 4-7-8 breathing, which is 4 seconds in, 7 seconds holding your breath, and 8 seconds exhale. So we use that a lot, even in our clinic visits with the patients, just to demonstrate that practically. We'll look at biofeedback. We use HeartMath in our clinic, which is really great. Acupuncture is really great. And then things they can do at home, things like singing, chanting, gargling. Also gag reflex, although I don't know that anyone wants to really put a stick, into their throat and cause a gag reflex, but that will stimulate your vagus. Looking at pets, looking at like Adrian's dog there, Cannoli, so, pet therapy, nature therapy, getting out there, that's going to really relax the body and the mind and kind of balance that gut brain out. So we actually feel like, vagus nerve rebalancing is really concurrently a necessary requirement in addition to the gut health treatment. It's really all the same.
That's perfect. Perfect answer. Thank you so much. What happens in those with IgA deficiency syndrome?
What happens when there's like low secretory IgA?
Correct.
Okay. So definitely the immune system in the gut would be weaker. So we will have a higher chance of having pathogens or bacterial overgrowth when we don't have a strong immune system in the gut, is what I would.
Yeah, so exactly. And just, that's where they might get a SIBO, kind of symptoms, and then that would be helpful to diagnose that with a SIBO test like Commonwealth's. We also can think about IgA as one of the ways immunoglobulins that help keep the gut lining intact. So low IgA is also associated with leaky gut too. So having that serum bovine immunoglobulin or SBI, things like that, that's going to help with both increasing the IgA, but also to help to heal and seal the gut lining. Chinese mushrooms. I think there's a question about Chinese mushrooms. I know, let's see, there's shiitake and enoki and different things. Reishi, I know, is a good one for NK. Yeah.
Lion's mane, turkey tail. All of those and shiitake would also be great.
Yeah, thank you.
Yeah, that was the next question is what Chinese mushrooms do you suggest? Going back to the case study, how are you measuring zinc and iodine? Is it in the blood?
Plasma zinc, right, Dr. Wan?
Yeah, so we've tried different ways. So I know there's some training on how red blood cell zinc is more accurate. We use LabCorp in our practice. We haven't found, sorry to LabCorp, since if you're listening to this, we haven't found the RBC zinc to be that accurate. So we've kind of gone to serum zinc, and we use a serum zinc, a zinc copper ratio. So we're looking at zinc and copper together because zinc and copper will counterbalance each other and affect each other in an inversely proportional way. So we're looking at usually a ratio of 0.8 to 1.2 there as a general functional, standard or, kind of optimal ratio. And then iodine, again, between urine and serum iodine, serum is going to be more accurate, but I think it's not a perfect test. I know there's like urine iodine spot tests and things that I don't think we have experience with, but there are labs that do that spot iodine test. So serum iodine we will use, and we'll often recommend things like kelp or iodine supplementations, depending on like low dose iodine supplementation, to try to bring that up if that's there.
Great. Are those with IgA deficiency at risk of bowel symptoms?
Yes. I mean, just based on the fact that there's going to be an overgrowth of bacteria often in those situations.
Sure. What do you use for biofilm disruptors?
We use different types of biofilm disruptors. For patients that are very sensitive, we tend to use NAC. That can be a gentle way to break down biofilm. We also use certain products that have enzymes like Interface Plus that can help break down the biofilm through enzymes, or we also use Bismuth products. So there's like biofilm phase 2 advanced product that has bismuth in it. So yeah, we or a compounded type of biofilm that we would use through a compounded pharmacy with alpha lipoic acid and bismuth and something else that is escaping my mind. But yeah, those, I don't know, Dr. One, if you think of any.
Yeah, I have to give a shout out to our friend Ruth. So she's a nurse practitioner who's involved with a lot of chronic infections. And this is really relevant for SIBO, which is why I want to bring this up, is that some bacteria do actually secrete biofilms. There's certain gram-negative bacteria, especially that secrete something called extracellular DNA or eDNA biofilms, in which case, bismuth would be a good adjunct treatment to the herbals or the antimicrobial, like the antibiotics. So if you have a patient with, say, a stool test and a SIBO test, sometimes that can be helpful. Or if someone's not getting better on your SIBO treatment, you have to think about biofilm treatment. So for eDNA, Ruth Chris talks about bismuth as a protocol. And then for other biofilms, like if someone just has chronic inflammation overall, your patients with autoimmune conditions, your patients that have metabolic syndrome with vascular inflammation, they're going to actually have a fibrin biofilm issue often. So they can't actually clear infections because they're nestled in this tent of fibrin, which is going to generate more hypercoagulability and blood clots. So in that case, we would use lumbar kinase as a enzyme that breaks down those fibrin biofilms. So it depends on the biofilm, but Ruth Chris has a great website. She's really generous with her time if you reach out to her. So I know that's not part of the CDI, but it does make sense with regards to, if your patient is having a SIBO diagnosis and symptoms and they're not getting better, you have to consider biofilm treatment.
Yeah, absolutely. I mean, it's a team effort. Can you discuss the protocol on retesting for this test?
Yes, we tend to go like depending on the case. So when we do let's say a patient comes back with a level of hydrogen of 60 parts per million, we do every round of treatment, which for antibiotics would be 2 weeks and for herbals would be 4 weeks, or for elemental diet would be 2 weeks. It lowers about 30 parts per million for antibiotics or herbals. So let's say we do 2 weeks of antibiotics, 4 weeks of herbal treatment. Once we complete our treatment protocol and if the patient is feeling good, then we can consider retesting then. If the patient is not feeling good after the treatment protocol, we would probably use like adjunctive treatment and try to see like anything else that is needed to help them feel better. But we tend or repeat another course of treatment, but we try to retest once they're feeling better, so that, because if not, we might retest and come back positive. And it just depends on like case by case. I don't know, Dr. One, if you wanted to mention anything else.
Yeah, I agree, Araceli. I think it really depends, case by case. Like I think in the case presentation, you saw the patient was, it seems like she was kind of afraid of what the test would show. And so sometimes people that are getting better, they may not want to retest right away because they're getting better, their symptoms are better, and maybe they wait a little longer. Whereas someone else that might be more data driven and they kind of want to see where things are going, they might want to test after a month, or something with a 2-week washout period. So it really depends on the patient, like I said, but we do like data. So we do like to try to check them within ideally 3 to 6 months, I think, in general. But there's probably a balance between having like too little testing and kind of flying blind versus too many tests, which might exacerbate people's, medical related anxiety. So
yeah, 100%. Speaking of that balance, that's very important. How do you approach treating SIBO in people with non-modifiable risk factors like cystic fibrosis or other diseases?
Yeah, that's a good question. Araceli, you want to take that first?
Yeah, I would say, well, it depends like what's going on. We try to see if like they're on other types of medications or things. We always try to check for interactions with any of the treatments that they're using, or make sure that it would be safe. Rifaximin tends to be pretty safe or well tolerated because it's so localized to the small intestine and not systemically absorbed. So we try to see what would be better for the patient, or maybe using single herbs instead of like combination products that have like more herbals in them. We try to keep it simple depending on what else is going on.
Yeah, that's a tough one. I think, when you think about the functional medicine model and trying to lift all the different legs of the table at the same time, right? Because that's kind of like looking at all angles. But with something genetic like cystic fibrosis, maybe one of those legs of that table, like with your patient that, asked that question, is fixed. It's like fixed to the floor. So maybe you can just pivot the other piece of the table. Definitely would think about NAC or glutathione as a way to, NAC as a sort of a mucolytic. We know there's evidence there for COPD and reducing mucus secretions. And I think certainly nutrition, makes a lot of sense in anything that would do, I guess, increase the mucus, like dairy, that would probably be something if they were having trouble with dairy, try to eliminate that and things like that. But, and also motility, CF would likely affect, general motility. So that's where I would go. I would kind of go with a general functional approach, looking at hormone levels, looking at motility, looking at adrenals, thyroid, nutrients. But you can only do so much, in certain situations, but at least try to pivot what you can pivot, basically.
Yeah, perfect. How do you compare this test with stool tests that claim to test for methanogens?
We tend to use them both. So we take a look at the stool test, and that way we can see bacteria, parasites, yeast that can be present both in the small intestine or the large intestine, and they do test for methanobacteria as well. But when we do the breath test, it tells us more on like where it's located and how much. If they're producing like too much gas on the small intestine, it's when it's typically more symptomatic than if it's in the large intestine. So yeah, but we use both.
It is, and we do use both. It is important to kind of know as a clinician when you're stating that to the patient, like if they have SIBO or not. The stool test is not a gold standard for SIBO. It might suggest there could be some overgrowth, but remember that it's a stool test, it's a large intestine test. In order to get from the large intestine to the small intestine, that bacteria has to translate across the ileocecal valve to the small intestine. So even if there is some Methanobacter or Enterococcus or Bacillus or different things on the stool test, we can't say for sure that there'll be a SIBO test, which is why it's nice to do a SIBO test as well. Because, just like with real estate, location is everything, right? The bacteria, right? If it's in large intestine, it's overgrowing there. Maybe it's good. Maybe we need more bacteria there because people can have, right? Patients can actually have what's called an insufficiency dysbiosis, where there's a lack of good bacteria. And that will also cause similar symptoms of maldigestion and things like that, IBS. So we have to really be careful about, where those bacteria are and, use that real estate analogy, I think. But yeah, I think like Araceli said, doing both tests is ideal. Yes. Location. That's right.
Yeah, I love that analogy. That's great. Last couple questions here. And this was another question that came through the chat. If you give the SIBO herbal protocol for 4 months and retest right afterwards and the gas levels increase, why could this happen?
It could be different things, but one thing it could be if at the beginning it was hiding because of the biofilm, and then you've gotten more of the biofilm and there's more of the bacteria like actually being able to test. Or it could be that there is some like dysmotility as a root cause. So even though you're treating some of it, it's still like because things are not moving along correctly in the gut, you're treating, but it's still overgrowing in between the treatments. So yeah, I find those two are the most common ones, or low stomach acid, and just sort of needing to address that and the nervous system to help the motility work properly.
Yes, and thanks, so Christina brought up a great point as well as SIFO, is that some people could have small intestinal fungal overgrowth, and there's not really a great way to check that. We do sometimes use the stool test as a proxy because we're going to check Candida on a culture or a PCR DNA test for Candida overgrowth, but you can also use clinical symptoms for Candida. You can use things like whitish tongue, craving for carbohydrates, chronic sinus infections, chronic sinusitis. Dr. Rob Ifker wrote a book called Sinus Survival I think it's been a couple of decades now, but he found research that 80% of chronic sinusitis is chronic Candida overgrowth. So you can use these other clinical symptoms sometimes without testing, and you can empirically treat with herbals or antifungals. And sometimes that is the missing piece. But then, like Araceli said, there's some root causes. A lot of times low stomach acid, low bile acid motility issues, immunoglobulin deficiencies, things that maybe low thyroid, so things that you maybe need to take a deeper dive back into the functional medicine matrix and try to figure that out.
Perfect. And then the last question we have here would be, there are a number of other breath tests available on the market. What about CDI drew you to them, and really what's your favorite part about working with the CDI team?
Well, I'll answer a little bit first, and then so I would say, first of all, Commonwealth, and in my opinion, because we've tried multiple breath tests over the years, really, and they all have kind of pluses and minuses, but certainly Commonwealth, I would say, it gives a reliable test. We trust in that validity of that product. It uses a lot of the standard, North American GI guidelines in terms of the criteria for interpretation. And then the other thing we like about Commonwealth, they're just so easy to work with, with regards to customer service support, the administration at Commonwealth is so good, Craig, et cetera. So I guess just, partly when you're a clinician looking out there for different tests, there's so many different tests out there, you're going to want ones that are safe, they're reliable, they're validated, and that they are easy to work with. And I think, Rupa has also made it a lot easier with the Rupa Health and CDI partnership too, in terms of if you have, 30 different lab tests you want to order potentially for a patient, what are you going to use? Sometimes you can use that umbrella like Rupa to really help to order tests in a very efficient manner so you can focus on clinical care.
Thanks for the shout out, Dr. Wong. That was great.
Sure, no problem. Not rehearsed, right? We're just trying to.
Yeah, that was awesome. So those are all the questions that we have time for today, folks. We appreciate you so much for joining us. Do you all both or either of you have any final thoughts to get out there before hopping off?
No,
honestly, not necessarily, but we just wanted to thank Rupa and Commonwealth and all of you attending today for participating and listening. It's been a real pleasure. Cannoli, by the way, is a great name for a dog. So
thank you. I'll get him back on the screen.
Please get him back on the screen. Yeah.
Well, Cannoli's off in the hallway somewhere, but you can see Lola. This is my other dog here. We've got a long-haired wiener dog.
Oh, nice.
Well. So she's the real boss of the house.
Very nice. Great to see Lola.
Yeah, well, we appreciate you both for taking time and giving such an amazing presentation today. You're welcome to hop off, or you can stick around because we're going to transition just right into a Rupa Health demonstration and show you exactly how to order the CDI tests from our platform right now. So I'm going to hop in and share my screen, and we can just jump right into it. So for those of you who are new to Rupa Health, my name is Adrian. I am the head of practitioner partnerships here on our team. And really what that means, that's just a very long title for I work with our practitioners to ensure that you're set up for success and educate you about Rupa. So who are we? What do we do? And why do we host these weekly webinars with our amazing lab partners? Well, we are a functional lab platform. We're designed to make it easier for you to track and manage and order all of your labs in one place. So the way that we've done that is we've brought on over 30 different labs, including CDI. So now instead of having to create separate accounts with all these different labs to have your breath tests, your stool tests, your hair tests, you have one account with Rupa Health, and you can order from over 30 different labs, over 3,000 different tests, including CDI, of course, without having to go to each individual lab portal to sign in, place your orders, track and manage your results. We have everything in one place for you. So the Dutch, the ZRTs, the Genovas, you name it, right? All in one spot. And starting an order is as simple as knowing your patient's first name, last name, and email address. From there, I can hop in here and I can create things like custom bundles at the top. So sets of tests, sets of blood panels that I want to order from, a number of tests. I have them all in my bundle. I can have one click and have multiple tests added into my cart at one given time. I can customize these however I want. Down below, I can create a favorites list. So individual tests that you're commonly ordering. So for example, the SIBO test from CDI, I can go ahead and just select that. But I can also order from any other kit that I want to. So you can see all these different favorites that I have, the GI 360 from Doctor's Data, GI Map. I can order my blood tests from Rupa Health. I can order my food allergy tests from Rupa Health. And from there, it's as simple as clicking send a patient. And that's how you order from all those labs in one place. Now let's talk about how our pricing works. We offer wholesale practitioner prices. So those same prices that you would get having an account directly with the labs, those are the same prices that we offer here at Rupa Health. So you can see, for example, if I'm ordering the Hue Map from Doctor's Data, that normally would cost my patient $500. At Rupa Health, it costs $150 for your patients. So we're always providing that lower price to your patients when they're paying for these tests. The way that we generate our revenue is very simple. We charge a 7% processing and ordering fee on each order, and that's paid for by whoever's paying for the tests. So if you're having us bill your patient directly and they're the ones ordering and paying for the tests, then they'll be the ones similarly paying, in this case, $24.66. Rupa is free for you as a practitioner in that circumstance. There's no cost to sign up for Rupa. It's free to sign up for. There's no contract that you're signing. There's no minimum spend. There's no subscription. This 7% that you're seeing is the only way that we generate our revenue. And that's paid for, again, by whoever's paying for your tests. You, of course, do have the option of paying for the tests yourself. If you do choose to do that, you can bill the patient separately outside of our platform. That's completely fine. You can add notes for the Rupa, or notes for the patient, notes for us, and you can even add ICD-10 codes as well. So if you do want your patient to submit a super bill for reimbursement from insurance, we can actually automatically create that for your patient by sending them over just a little template. They'll fill it out and it'll generate that super bill. All you have to do is add ICD-10 codes in your order. My favorite one that I found recently is sibling rivalry. So you can just go ahead and add that in there and go ahead and send that to your patients. It's always fun. From there, we have additional options. You can do things like adding your own custom fee. So for example, if you do want to add an interpretation fee and have your patient pay for that, that's completely fine as well. The second component to Rupa Health, which is extremely important, is not only is it a place where you can order all your labs and track all of your results, but you can actually also have us manage your patient experience as well. So as soon as you click send to patient, we'll actually manage the whole patient experience. So we'll reach out to the patient, we'll ship the kits to your patients, we will send over FAQs, instructions, walking them through how to take the tests. We'll handle any support questions that they have. We'll even handle any specimen issues and help them coordinate a phlebotomy if that test requires a blood draw. From there, we'll follow up with them, and then you're alerted as the results come in. So the patient experience, as we all know, since you're practitioners, can take up a lot of time, right? It can be a massive pain point when it comes to ordering these lab testings and the experience. So we want to alleviate that pain point by taking care of all the support required for you to be able to send these tests to your patient and have them done successfully. This is what it looks like. So as soon as you click send to your patient, we will reach out, let them know that these kits have been ordered. We'll introduce ourselves, and then we'll actually highlight some really important and also awesome options that they have to pay. So not only can they pay with credit or debit, but they can also pay with an HSA, they can pay with an FSA, and they can even set up a 3-month interest-free payment plan with us to pay for those kits. These tests are expensive, right? And paying for them can be a really big hindrance for your patients to be able to take these tests. And so by offering these different options, this helps us be able to provide these kits to your patients and lower that barrier to get access to it. If you decide to pay for the kits, nothing changes in terms of the patient experience. The big differentiator there is that we're just not going to show the cost of those tests. Since you're paying for billing, we won't show the patients what you paid for it. From there, we'll send over an email that looks very similar to this. It will outline instructions for each one of the tests. It will we'll walk them through how to fill out the requisition form. And as I mentioned before, we'll help them coordinate and schedule their phlebotomy. We'll send over customized instructions that are not only comprehensive, but also as important, they're very user-friendly. So they can click into different sections, see how to take their tests. But if they do need any support and have any questions when it comes to their test, they'll reach out to us and our team, and we can go ahead and handle the support side for you. If, of course, it is something that's going to be a little bit more medical related, we'll send them back your way. If it requires a specimen issue and a retest, we will go ahead and work with the patient and the lab for that recollection. You don't have to be involved, but you will be alerted, so you'll be able to be in the know. From there, we'll follow up, and then we'll send you an email once those results are ready. You're able to view those results right in your Rupa Health dashboard by hopping in and logging in. You can search by patient. You can filter by status. You can see all these different statuses of my orders. But if I'm curious as to what is going on with any one of my orders with my patients, I simply open it up. I can see when the sample arrived at the lab, when my results are in. I can hop in, I can download them, I can send them to my patients, I can schedule a clinical consultation. So if I do need some assistance interpreting those results, then you can go ahead and schedule some time with a clinician from the lab. And also, we even integrate with a couple EHRs. We integrate with Optimantra, with Serbo. Actually, that one just got signed, so Serbo very soon. We work with Practice Better. We work with a handful of others, Body Sight, and a lot more actually coming. So if you do work with an EHR, we can have these results sent directly into your patient profile, which is pretty incredible. So again, the idea here, Rupa Health, is just to make life easier when it comes to lab testing. It's free to sign up for. We can work with you, whether you're a solo practitioner, whether you're a multi-location clinic with 20 clinicians or practitioners, we can work with you. And then final thing that I want to show you here is just Rupa University. You're all actually a part of Rupa University right now. Welcome in. Rupa University is our educational component to Rupa Health. So you're able to hop in here and you can either attend these classes live. We always record them, we'll upload them, so you have access to all the previous sessions that we've done right through Rupa University. And we even have paid options. So if you are interested in attending one of the boot camps that we do here, I'll show you the upcoming ones we have. We have one coming up with Dr. Jaquel Patterson on Lyme. We have one coming up in November with the doctors Vojdanis, as well as Dr. Jeff Bland. So super excited for that one to come up. So check it out, rupauniversity.com, where you can get access to all your labs in one place, but also some amazing educational opportunities that we have here. I'm going to share my contact information. So if you do have any questions, reach out to me here. I saw some questions come into the chat, so I'll spend a moment or so to answer those. Let's see what that was. Can you order SIBO test kit for office use? I'm not sure what you necessarily mean by office use. Is that like solo use as a practitioner? But to answer your question, yes. You can order the SIBO through Rupa Health. Not necessarily sure specifically what you mean by office use, whether you want to stock the kits in office or just use it for yourself as a practitioner, but you should be able to do both. But again, if you do have any questions, let me know. Stock the kits in office. Great question. So we're working on building that out. Right now, you can stock some SIBO kits in office. I'll have to follow up, and if you can stock CDIs in office, not entirely sure on that. I don't believe so, but I'll confirm that here after we hop off, and I can follow up with you, Dr. Patel. But with that, that's something that we are building out. So if we're not able to necessarily allow you to stock the kits in office yet, we will be able to in the near future. And let me touch on that a little bit further. Rupa Health was kind of founded during the pandemic. That's when we really did take off. And as you can imagine, and as I'm sure a lot of you know, during the pandemic, most practitioners were seeing their patients via telehealth. And so our platform was really designed to primarily have these kits drop shipped to patients. And so the ability for us to stock kits in office is something that we are currently building out. It also comes with its own challenges. For example, the ability to create immediate requisition forms through our platform. So there's a little bit more that goes on to it than just the ability to stock the kits in office. There's quite a bit of engineering work that goes on in the back end, but it is something that we are working on actively, and we are excited to have that come out in the very near future. So great question. And it's something that we are building out. And even just to touch on that a little bit further, to expand on that, Rupa Health is a tech company, and we're actually a pretty small company. There's about 50 to 70 of us working on this team. And so when we put our minds to something, there's not a lot of bureaucracy. There's not a lot of barriers that prevent us from doing it. And so when we want to create something, we can usually work pretty quick. So keep an eye out and looking for any updates on those in-office kits. We're excited to be continuing to build that out. But with that, y'all, again, my name is Adrian Martinez. I'm the head of practitioner partnerships here at Rupa Health. If you do have any questions, this is my contact information. I appreciate you so much, so much for joining us today, along with CDI. And keep an eye out for a couple of things. We'll go ahead and send out the recording in the next few days once we've had the opportunity to edit it. And if I do hear from you, looking forward to it. If not, enjoy the rest of your Wednesday. We'll see you next week. Take care.